Let's talk about the Urogynae history points during OSCE station. What are the different things which we need to know? So here, first of all, we need to ask about the complaints. What are the complaints? What brought you here today? And then since when this has started, right? And how frequently you need to go to V, and does your bladder wakes you up in the night as well to check the nocturia thing? And then coming on to any burning and stinging in the urine, any hematuria. So these points are important to ask. Then need to ask, do you need to rush to the toilet um, when you feel like passing urine? And does it leak as well? Okay, before reaching the toilet, does it leak on coughing and straining as well? Oh, okay. And then does it leak while having sex? First, you need to ask, are you sexually active? And does it leak during sex as well? Okay. Do you have any, have you ever taken any treatment for this problem? Any investigations if you have undergone? Okay. And apart from that, you need to know, are you on any other medicine, for any other chronic long-term problem? Okay, and then you need to check with any bowel issues if she has, like any constipation. And do you feel that something um, is coming out of vagina, or if there is any vaginal lump, to rule out any prolapse element. And then check for the post-micturition symptoms also. Do you leak after passing urine? Do you have any difficulty in passing urine, right? Or do you take longer than usual time in passing urine? And so this is hesitancy, post-micturition dribble. And then you need to check for the painful micturition. Okay. So these are the history points of urogynae, of the presenting complaints to rule out FUI, UUI, and any mixed factor. Okay. Another point which is different here is in gynae history. Like you need to know the menopause thing. Okay. Is she on any HRT or she's not? Okay. And what about the frequent urinary infections? Frequent UTIs. Obstetric history is again very important, which includes how many children do you have, need to know her parity, any difficult delivery, did you have all vaginal births or any cesarean births? And during vaginal, were there any history of long labor or instrument application? So that comes in difficult delivery. So you can ask that ways. Then coming into the medical history. So drug allergy is a safety point you need to ask, and other medications we have already asked, so no need to repeat. And other illness also you need to check whether she is diabetic. Okay. And hypertension, obesity, so need to check with the BMI. Okay. So these are the points in the patient safety. Surgical history, yes, it is important in terms of any pelvic surgery, any cancer surgery, any radiotherapy. So this is all important to check in this. Now, then coming on to the smoking, which is very important to ask. Alcohol, important, it's a bladder irritant. Then fizzy drinks. Fizzy drinks are important to ask. Coffee, how many cups of coffee she takes, it's a bladder irritant. So these are the things which you need to check. Mental health you need to establish in every case. And then this domestic violence thing, just one liners for them. And this is how the history differs. Fluid history, this coffee, tea, fizzy drinks, this history is different and important in Urogynae stations. So that's all about the history points which you need to ask, and you have to take this history along with the patient's response in 3 minutes. Try to complete it in 3 minutes. That's all.